And thank you for joining us. Today we're going to talk about mental health and substance use disorder with stepping stones and behavioral health. It's an important conversation to have for a number of reasons, and it's going to be fascinating to see how everything ties together, not just with the patients, but what the community should know as well. We're going to start right here with Dr. Dorta. Dr. Dorta, introduce yourself and tell us about your position.
My name is Humberto Dorta. I am a psychiatrist. I was trained as a geriatric psychiatrist, actually, which is taking care of people 65 years or older. But I've now been here for 19 years. When I first came, there were 4 psychiatrists, 1 on the way out. Shortly thereafter, I was the only psychiatrist for a number of months. And since then, we've recruited a whole slew of providers. I am the medical director of Behavioral Health Services and the medical director of Mind Body Wellness Center, which is a smaller group within our group. And my role is to make sure that all the services are running properly, that we're properly staffed with providers, which later Cliff will speak about staffing with nursing, et cetera, but I'm talking about psychotherapists, neuropsychologists, and psychiatrists specifically. And I also work some at Stepping Stones with Dr. Miller. So I also go to nursing homes. So I do a lot of things in behavioral health.
Great.
Cliff Burke, I'm the nurse manager of Inpatient Mental Health and Stepping Stones. Been on Inpatient Mental Health since 2005, so 19 years, just like Dr. Dorta. I think I came a few months before he started. 2009 is when I became involved with Stepping Stones as the nurse manager, with Kenlo McGowan as the program supervisor. Really enjoy working with the behavioral health population. Really have enjoyed the relationship formation that you can have in this setting, and get to know patients over the years and kind of continue to work with them and have continuity there.
Excellent.
Okay. Hi, I'm Jill Miller. I am board certified in family practice and addiction medicine. I've worked in addiction medicine since residency, and it's been about 15 years now, and I'm the medical director at Stepping Stones and also the medical director at Crawford County Drug and Alcohol. And I've had a passion for taking care of people with addiction problems, and I'm glad to try and make a difference in our community. And recently we've been working on bringing a new level of care to Meadville, and finally, after years of trying, we've been awarded a license. So we wanted to make people aware that we have more resources available to them, and we want them to come in and get help.
I'm Kenlo McGowan, the program supervisor of Stepping Stones, and I've been with the hospital for 40 years and the unit for 39 in a variety of positions. And I've been able to watch us expand in many ways, and like Dr. Miller just said, to add this next level of care, which will hopefully allow us to provide our services for more people, not only the ones like now where they have a severe medical condition most of the time in addition to their substance use disorders, one that would require hospitalization in and of itself. The people that may have been more stabilized by the time we get them, but still have things that need hospital-based care. So we are going to be able to offer this for more people within our community and outlying counties as well, like we do at this time. I've also, been able to be part of or watch us add different layers to our staffing as far as intake coordinators for clinical assessments and for a higher level of counselor with master's degrees, master's prepared, and licensure. And I myself am a licensed professional counselor. So we have added our outpatient services since we started in 1984. As well as an employee assistance program, assessments, and critical incident stress management, debriefing. So a lot more things, through the years.
This is a subject I think that is probably maybe difficult for a lot of folks to understand, to take in, to figure out who would utilize the services provided. So let's start with a basic understanding of the patients you see, who are people that you see, who are patients that should be calling and setting up appointments? Kind of describe just the variety of patients that would come through the door.
So, because we have so many different levels of service, there are different kinds of patients that we see. In inpatient mental health, we see people who are in acute need of emergent psychiatric care. Those are people who are in danger because of their mental illness, and that can be as simple as being unable to take care of themselves to people who are having suicidal thoughts or who are so confused by the mental illness that it's dangerous for them to be around other people. We have a very unique unit. In fact, I've never been to another one like it, in that we are licensed to treat patients from age 14 until death. So we have a mixed unit, and I've never actually heard of another one like this. It's very necessary because we don't have the patient population to have a child unit and an adult unit. The only way we can treat teenagers basically is if we have this mixed unit, which the state supervises, and we have very special rules in our unit because of this, because obviously we have to protect our minors. And everybody who is in there has an acute, severe mental illness problem at that time. Once they move out of the psych ward, then they move to a different variety of treatments. We have 10 therapists, I think 10 is the right number, divided in 2 different offices. And these are people who do counseling, from specialized counseling like EMDR, which is a very time-specific and modality-specific treatment, to supportive psychotherapy, which is where you go and talk to somebody essentially to vent. We do psychodynamic therapy, we do DBT, which is again specialized for a specific kind of illness. All the different therapists have different specialties. We have a few therapists who specialize in seeing kids, which is an entirely different approach, as you might imagine, talking to an 8-year-old versus talking to an adult. We also have 2 neuropsychologists whose job it is to do specified testing to objectively find out if somebody has ADD or if there's any kind of cognitive problem like dementia, Alzheimer's, which is a type of dementia. It's the most common one they test for. They don't have long-term relationships with patients. You come in, see them 4 times, get tested, and that gives us an objective way to treat. And then we have 6 psychiatrists who see patients. We all are trained similarly. I think I'm the only one who has a fellowship in geriatrics, but we all went through the exact same treatment. We all treat patients the same. We meet regularly. In fact, we meet once a week as a group to discuss patients so that everybody's on the same page about how we're going to treat. One of the psychiatrists, though, is a child psychiatrist. He does have a fellowship in child psychiatry, and he's very busy, as you might imagine. He's new. He was our last psychiatrist hire, and he just graduated. And he mostly sees children. He sees up to the age of 18. And we have 3 nurse practitioners. 2 of them are so there's 2 major clinics that we have. We have Mind Body Wellness Center, where Dr. Talarico and I sit. We see any age patient, and we have several therapists there and a neuropsychologist. And then we have the Meadville Behavioral Health Clinic, which is in Alden Street. There we have 4 full-time psychiatrists. One of them is the child psychiatrist, another neuropsychologist, and several therapists. Where they go mostly depends on their insurance, but we all treat everybody the same way. The only exception, we are about to start groups. We're going to have a men's group, parenting group, and a DBT group. And patients from either setting can go across to the other side if the group that they need is in that place. And then we treat patients in the nursing homes, which sometimes go there from the psych ward. So when somebody's done in the psych ward with their acute severe problem, then we send them to one of these places where they typically get a psychiatrist or a nurse practitioner to provide medicines. And this is something that people confused a lot. Psychiatrists are trained in psychology. We can all talk. But for the most part, our job is to make sure the medicines are right, that the medicines that we put them on don't interact with other medical drugs, and to ensure that they're safe. And then the therapists are the people that you meet regularly once a week and talk for an hour and explore your feelings. Those can be clinical social workers or psychologists, and we have a couple of doctoral level psychologists also. And then we have some nurse practitioners that also provide medications. Those are supervised by the psychiatrists. So we have all of these levels. And I saw somewhere in the pamphlet a question about a step down. There are places in larger cities where there's more resources that there are in-between steps where you go from an inpatient acute unit to a longer-term partial hospitalizations. We don't have that in Crawford County. We might look into that. And that is pretty much all the services that we offer and who belongs where. I was brought up in medicine believing that most people should have some kind of behavioral health contact. I saw a therapist. I had several difficulties, especially with personality when I was in residency. It was very difficult for me. And I found it super helpful, but even if you don't have something that you can say, well, you're depressed or you're anxious, talking to somebody on a regular basis who's not your family, somebody who you don't owe something to, can be really helpful. So anytime anybody asks me in my social life, do you think I need to see somebody? I say yes, whether I think there is a problem or not, because it's a very unburdening experience to be able to talk to somebody who has no stake in the game.
So then, Cliff, for you, you're seeing patients coming in that, again, might be to that level where, hey, it's just good to talk, to extreme cases.
Yeah, it's part of it. Our average length of stay runs between 5 and 6 days, and if somebody comes in with depressive symptoms, they're not going to get the full effects of those medications for a few weeks. So people get better during that time because of the structure that we provide them. They know how it's going to be, what time this is going to happen. The rules kind of support them, so they come from chaos. Coming from chaos, we give them structure, so that really helps. And as part of that is talking to staff routinely, us directing them where they need to go, plus the medication aspect of it. And the most common diagnosis that we would have would be major depressive disorder. Kind of the more complicated cases are the mood disorders or the thought disorders that kind of have longer lengths of stay. And those can be a little more challenging, a little more give and take with the patient as we work with them over time. But those are also, can be very rewarding too, as you get them to start doing better and then work towards discharge with the follow-up that Dr. Dorta mentioned.
Dr. Miller, whether it's family or an individual, a strong foundation is important. So sometimes it's coming back to those basics, right, and kind of figuring out that and then going from there. But talk about some of the patients that you see.
Okay, well, we also have a very unique unit at Stepping Stones. There's only 2 other units like ours on this half of Pennsylvania. I think a lot of people in the community would be surprised to learn that we are the highest level of care offered for addiction medicine. So in order to be admitted to our unit, as it is now, you need to have a medical problem in addition to an addiction issue. For example, you might have a liver transplant and an alcohol addiction. So we can't take everybody at this time for inpatient, but that's one of the things we're working on with our new unit that's coming. But we also offer 2 levels of care at our unit. We offer acute detox, which is a minimum of 3 days, and we also offer a level of treatment that patients can stay with us up to 30 days. So it's all in the same unit, but we have all of the resources a hospital would have. So if you come in for detox of, say, alcoholism and you're unable to walk, you can get physical therapy along with your treatment and medications. And we also do have psychiatric available, as well as almost every other specialty will come and see you at our unit if you have a problem. So we can take people with wounds that need to be healed and heart failure and liver issues. So it's very unique to have a place like that, and a place that can take Medicare payers, which is awesome because very few of the step-down units are able to do that. So when I say that, I mean other inpatient units in the area that are not hospital-based. And what else about our unit, Kenlo? We have a lot to offer that.
Yeah, and we are defined as short term. So like she said, usually 28, 30 days, the routine. People don't always stay that long, but we do get people. Let's say someone on IV antibiotics infusion for 6, 8, 10 weeks. They obviously can't stay in the acute care unit of the hospital, and they usually can't go to a nursing home or personal care, because if it's due to IV drug use, pericarditis, endocarditis, then they're probably still in connection with people that they used with or used IV drugs with, and so that becomes a problem in other settings. So obviously with us, they get, the 24-hour day nursing care and the infusions, and they also get the counseling and the group therapy and the rehabilitation piece to hopefully keep that from, going to a point where they're non-compliant and go back to active use again once they go home. And it's something where, they can't just go home and come back every day either because of the safety issue with, having a line-in, which would have to be removed every single time before they left the premises. So things like that people might not ordinarily think about, but that unfortunately we see more frequently, or the fact that we're the only inpatient rehab in Pennsylvania right now that will take someone who's on hemodialysis, because we have a dialysis unit and a nephrology practice. So they can come get that 3 times a week here. And mostly they're referred to us because they've been non-compliant with going to their visits in their home area, wherever that might be.
And they want to get a kidney transplant, and they have to be clean for 6
rehabbed
months.
first, yeah.
So they will come to us to get that start. And you also reminded me that the type of patients that we get are patients that want to come in and get help. They may be tired of the life they're living. They may have been given an ultimatum by their wife or husband that they need to clean up or get out. So we have patients that are willing to come in and want to, and we also have patients that are legally mandated to treatment. So we do get quite a variety of people. Right. And the substances that they may be abusing are alcohol, benzodiazepines, opiates. Currently we see a lot of methamphetamines, and I guess that would probably be the most common thing we're seeing right now. Right. But we don't really see heroin anymore. It's almost all fentanyl, which is a lot cheaper to make, and apparently coming from Mexico in a very cleaned up industrial way that they're doing it, so that they're making more and more money on it. But I don't think we've seen heroin in several years. Yeah. So.
Now, are they determining their course of treatment? Are they saying to you, I want to be out of here in 10 days, or are you working with them?
Usually they want to be out of there in 3 days, but for the most part, well, we can't keep anyone against their will. We don't have that ability, but we do recommend that they stay for the full course of detox for their safety. And then if they want to stay for treatment, it's decided with them and their counselor as a partnership on when they've completed, and then they do get a coin. They get what's called coined out for completing the program.
The difference between the two environments, so as Dr. Miller said, completely voluntary. You can't hold them against their will in drug and alcohol. Mental health, on the other hand, we do sometimes, a smaller percentage of our population is involuntarily committed. The vast majority is voluntary, but even those voluntary patients can't just say, I sign myself in, I want to leave right now. They have to submit a form that's called a 72-hour notice, which gives the doctor, the psychiatrist, 3 days to figure out whether they can safely be released or if we need to commit them involuntarily. We have a lot of common patients. Like, we might treat this person on mental health, they might go on to stepping stones, but the regulations and the rules of those admissions are different.
I don't think a lot of people realize when you're using alcohol or drugs, it alters your brain.
Yes.
I mean, mentally, it changes it chemically. You are a different person. So there is a lot of common elements there. Is that part of the reason why it's so important that everybody works together?
Well, I actually wanted to say something about that, but before I do, I want to make what Cliff said very clear. The inpatient mental health unit is locked, and we have to open the door. Stepping Stones is actually locked only from the outside, so a random stranger can't walk into the unit. But there is a push bar, because the law in Pennsylvania says that if somebody wants to leave drug and alcohol, they can leave whenever they want. Usually we can talk them into getting paperwork done and so on, but we cannot hold anybody in drug and alcohol. But yeah, that's another thing that's very unique about Stepping Stones. We get a lot of patients referred from other rehab facilities in the area because their patients have some kind of psychiatric emergency, which they can't manage. We can, and the reason that we can is because we're literally physically underneath Stepping Stones, and we share our nurse managers. So a psychiatrist can be there in zero time, and I actually work in Stepping Stones, so at least every other weekend I'm there. So any kind of ongoing psychiatric issue I can treat, and it's my specialty. So, so we're much more able to treat the whole variety of drug and alcohol problems because there's a huge comorbidity between the two.
Where does somebody begin? Do they call you? Do they call you? How do you? What advice would you have for people who might be watching this and going, "I know I need help. You know, what's that number to call? Where do I go first?"
So it really depends on what it is that they need. If you're talking about drug and alcohol, the best place to call is Stepping Stones, and what'll happen. Well, they can tell you what'll happen then. If it's more of a behavioral health issue, depression, anxiety, or you're not sure what it is, calling either the psych ward or any of our offices, because we are really the only providers in the county. If you call Mind Body Wellness Center, or if you called the Aldrin Street office, or you call the psych ward, you're going to get one of us, and it's going to be directed to the right place. That'll not fail.
Let's quickly just talk about this, and I kind of feel bad bringing this up because this should be a conversation that happens year-round. But we're coming into the holiday season where depression, you could make a list of things that start to maybe increase this time of year, right? We're going to be changing the clocks. That does something mentally too. What are warning signs people need to be looking out for? Maybe family members, friends. What should they be looking out for with themselves, with others, to know whether or not they should be making that call? Let's start down here.
I think just overall people withdrawing or isolating from things that they usually would be participating in, or friends or family, or not wanting to talk about anything, not doing things they usually enjoy, or, depending on, if the person has sought something else to try to cheer them up or for coping, not having a lot of money to pay their bills, or asking for help with money, or looking generally ill, because there are a lot of new chemicals out there, unfortunately, that kind of tear the body down relatively quickly, and that are available here in small towns. And a lot of people will, try to hide things like that, even things that are legal, like alcohol. If they feel that people around them aren't going to understand or going to judge them in some way. But just offering support, or people noting that there's been a change, and it doesn't seem to have an explanation as far as why. Or if something has happened, to suggest, would you want to go with me to talk to someone, or something like that, or asking, some key questions, about, you're not thinking of, doing anything to harm yourself, are you? Or you're feeling like, you don't want to live anymore, especially if it's, it starts to be very stark or very obvious to them.
I think we do see a lot more patients coming in shortly after the holidays, because family has seen their loved one and they notice that they're drinking all the time, or when you have a problem with alcohol, you can't make it through the night without getting up to take a drink, and it's also the first thing you do in the morning because you would be shaking or in withdrawals. So if they see their loved one at a family party and they're not drinking and they notice they're tremoring, then they realize there's a problem and they need to get help. So we definitely see waves of patients coming in after family members have seen them. And it is a good thing to get the family involved.
Right.
And to reinforce to them that it's okay to ask questions of that person that they're concerned about. You know, asking if they feel, you know, what's going on. And it's okay to ask them if they're having suicidal thoughts, because sometimes people get afraid that if they bring up suicide, then that puts an idea in the head, and that's really a myth. Asking the question just puts it out there. And you can look for signs in their response to you, and make you consider whether you're going to have to escalate things or not, or if you can talk them through it. You know, each scenario is different, but just not being afraid to touch on those tough subjects. Or have you been using drugs? And you know, conversations get a little heightened, especially if you're talking to your children or family, loved ones. But as long as they know, you know, people eventually figure out where you're coming from, you know, and that's from a place of trying to help.
Sometimes it happens that people are not sure there's something wrong, and they come to see one of us, and we will say there is nothing wrong. But it's important to ask a question. We all know when things aren't normal, what we consider normal within with our family members or friends. It's important to ask a question. You come talk to me, you talk to me for 30 minutes, and at the end of that, if everything's okay, and it's just, you know, sometimes it's okay to be depressed. If you lose a family member or a pet, it's okay to be depressed for 6 months, up to a year in the case of family, according to general psychiatry views. So it's okay to ask a question and find out. Maybe you need help, maybe you don't. If you don't, nothing happens. It usually starts with one of us at the office, not in the psych ward. The psych ward is a much higher level of care. But something you said, there's this misconception that as we go into winter is the only time that we see more patients. There are psychiatric illnesses that get worse in the spring. I actually tell the majority of my bipolar patients this is the worst place to live if you have bipolar disorder, because the seasons are so stark. The change you were talking about, the time change in Florida doesn't mean that much, but here it means a lot. It means you lose an hour of light, and light really affects how neurochemicals affect your mood. So we get a lot of depression now, and then we get a lot of mania in the spring. And so more important, the holidays are separate because the holidays do bring a lot of missing people who have passed away and missing relationships, etc. So that's a special case for us. But the seasons make a huge difference, and we're always watching, trying to make sure that people are okay.
Yeah, Cliff, you said something too that was fascinating, and maybe it's as a friend or a family member, maybe it's earning that trust. When that person that you know is getting mad at you for maybe asking the question, but you show that you're coming from a place of love, and I'm there for you. I just want to listen. I mean, that's important. Not lecturing maybe in that moment, but just listening.
Yeah.
And offering help. Do you need a ride someplace? Do you want me to come with you? There's little things that you can do, I think, to maybe help that situation.
And sometimes just weathering the storm, like understand that sometimes people are going to start with denial, and they're going to, it can be rocky. But if you're persistent and kind of, not banging them over the head with it, just continuing to chip away. Sometimes you have to fight through that initial difficulty, turbulence.
What about hospital staff? The primary care physicians all the way up. How important is it for them to also be on the same page and have that understanding, so they're not just saying, "Oh, here's somebody abusing drugs," but let me listen to them and make sure we're getting them to you guys to talk to.
Well, that's really important, that kind of that non-judgmental approach and kind of staying away from the stigma, so that people are more likely to get help if they don't feel judged for getting help. So that's a really, really big thing, kind of pointing the way without that sort of authoritative judgment. That really makes a lot of difference.
You mentioned filling positions and things growing. Any open positions? Anything available that you'd want to
Stepping
talk about?
Stones really needs
We do. We definitely could use some nurses.
registered nurses, licensed practical nurses. Mental health at this point in time, we're pretty good. Since COVID, it's kind of been a staffing roller coaster, and a lot of the places that adolescent treatment facilities, residential treatment facilities, they've experienced the same trouble getting professionals in all around. But it's really been a challenge to recruit registered nurses for Stepping Stones. We have full-time positions open.
Any
Sign-on bonuses available.
Oh yeah, no, that's important. Bring that up. Yeah.
I mean, it's also a wonderful place to work. I think that nurses that don't know about what our unit does specifically might think that their patients are hard to take care of, or that they wouldn't be treated, that they might mistreat the staff, but that's not the case, because the people we see want to be there and they want to get help, and it's really rewarding to bring someone in at their lowest point and see them in, within 3 or 4 days, a different person, almost unrecognizable. We always wish we could take photos of them to show them, because they don't remember what they've been through, but it's a very rewarding place to work.
Well, with that being said, there can be probably a lot of stress on your end as well. Do you mind sharing what you do at the end of the day to sort of unwind and separate yourselves? Maybe we'll start down here.
Oh, well, thanks. Well, I like to knit, and we rescue dogs, so that keeps us busy. We have 3 right now. And line dancing, so.
And you're going to demonstrate?
No.
Oh.
You have to pay $5 and come to class.
Okay. We'll all
It
be
does
there.
sound like fun, though.
It's fun.
So I have purebred Wheaten Terriers, and I'm a breeder. And also I do their full care, including grooming. So usually what I love to do is come home from work and take care of the dogs, and also with training the dogs. And then on weekends, I ski. My husband and son and I are a ski family, so we love that for our activity. So
We'll see you there if we get snow this year.
awesome. Yeah, we haven't had enough snow recently.
Clip?
I collect comic books, and we also have a small farm. We have 5 goats and too many ducks, about 16. We're like a sanctuary. You don't come there to live a happy life.
Yeah, maybe
We'll feed
you need
You
another
eat the
dog or two.
grass. Good on dogs, 3. About 4 cats. Yeah, it's pretty crowded.
Well, like I alluded to yesterday, I had some psychiatric issues during residency and college, and I hyper-focus on things. And I've always been a collector. Never of comic books, though. But the current thing is coins. I became a psychiatrist when I realized that I love stories and history. I was a literature major in college, and I have a minor in history. I did science sort of as a just in case, and as it turned out, it worked out. It's also I became a geriatrician because I love to talk to older people who have these long histories to tell. And I wanted to be an analyst. I wanted to talk. Anyway, when my grandmother passed away, I inherited a coin collection and quickly realized that collecting that stuff is fascinating. And I collect mostly foreign coins because I love the history and learning how to read Japanese coins. And,
Wow.
and I get so focused on that whatever stress I had, if I do that for an hour, stress gone.
That's really cool. Great stories. And you can tell that there's a passion there to listen to others and help, which is great. So the question now becomes, who do they call? Is there a phone number that they can call?
Yeah, our main number, which a nurse will answer 24 hours a day, 814-333-5811.
For mental health, 814-333-5800. And we can direct them, as they talk to us, we can direct them. Maybe it's more of an outpatient clinic issue. We can give them numbers to point them in that direction. Or if it's an emergent condition, we can give them instructions on how to get to the emergency department so that we can assess them in person.
That's actually the only number I know. Another one of my issues, I can't remember numbers. So I don't know my office number, and I don't know the Alden Street number, and I should. I literally have no idea what they are. So calling the unit, though, will always get you directed in the right direction.
And that's fantastic. And this is a conversation that we should meet up again real soon and continue to have. I think it's extremely important.
We
So
want to.
thank you very much for your time. Greatly appreciate it. Thanks for all you do. And we thank you for joining us as well.
Thank you.
Thank you.
Thanks.